all this week on UpFront.
Honest, candid, insightful. This is UpFront with Mike Gousha.
Hello again, everyone, and welcome to UpFront. For a while late this summer, health reform legislation appeared to be in serious trouble, especially after those intense town hall meetings during the August recess. But today, the prospects for health reform before the end of the year seem a lot more promising. The Senate Finance Committee will take a key vote Tuesday on a bill that would expand coverage to 94% of eligible Americans. The price tag, $829 billion over 10 years. The bill does not have a public option and would set up co-ops for the purchase of insurance. Now, this comes as a recent poll shows a change in public opinion. The Associated Press GFK poll says the public is now split on health reform legislation, 40% for, 40% against. That is a change from September, when 49% said they oppose the congressional plans and only 34% supported them. Final passage of a bill is still a long way off, but do these recent events suggest that momentum is now on the side of reform? And will the public option be a deal breaker for some Democrats in the end? We're joined now by Congresswoman Gwen Moore, the Democrat from Milwaukee. Congresswoman, good to see you again. Thanks for being here.
Great being here. Thanks.
I have to ask you, do you think the tide has turned in the debate over health reform legislation?
Oh, absolutely. I mean, after the August recess with the, deluge of disinformation, I think that that data and polls are demonstrating that not only the public always believed that some kind of health care reform was needed, but that there is a great momentum, not only among ordinary people, but even among Republicans. I mean, you've got 22 governors that support some kind of health care reform. Our own former governor, Tommy Thompson, a former majority leader and presidential candidate, Bob Dole, supporting reform and telling the Republicans they need to knock it off. And really, I think about 65% of the public supports the public option.
You support the public option, and let's talk about that for a moment, because the Senate Finance Committee comes out with its plan, and it does not include a public option. It also does not cover 25 million people.
Exactly.
If the final version of health reform legislation looked like the Senate Finance Committee version, could you support it?
Well, let's take one step at a time. I think we really have some heavy lifting to do in the House. I think it's extremely important for us to get that public option out of the House so that the public option will be on the table at the conference committee. If we're able to amass 218 votes to get that public option before the conference committee, I think that the negotiators will be hard-pressed to dismiss it. For one thing, our bill would cover everyone, all Americans, and not leave 25 million Americans out. The co-op, as you mentioned in your introduction, the CBO has said that it just won't get very much market traction. So the public option would bend that cost curve so that we really can have true health care reform, and it would include the majority of Americans.
Could a lack of a public option be a deal breaker for you? I mean, that sounds like that's absolutely crucial for your support.
Well, let me tell you this. I mean, the whole focus and purpose of health care reform is, in fact, to meet those criteria that the president laid out in the beginning. Is that, number one, it should be affordable and accessible to all Americans. That it ought to be available and to really cut down the cost of health care. I mean, health care is unaffordable to large businesses, to small businesses, to individuals. Medicare is unsustainable and would face bankruptcy unless we're able to bring some accountability into the health insurance industry. And the public option is a way of doing that.
Do you wish President Obama had been more emphatic right from the get-go and said, absolutely, I'm going to insist on a public option as part of any health reform
Coulda,
legislation?
shoulda, woulda, oughta. I think that he demonstrated a great deal of respect for the legislative process by saying, I'm going to give it to committees of jurisdiction, committees that have a great deal of experience with health care costs, and say, here are my criteria, put something together, and then weighing in the House, White House weighing in as we go along. I've appreciated that kind of respect because unlike what the public thinks we've had hours and hours of public hearings and experts, and that really has amassed the kind of support that we've needed. AARP, for example, supports the cost of health care reform. We have the American Medical Association, the American Nurses Association. We have all kinds of experts in the healthcare industry really weighing in on healthcare reform being essential and our moving in the right direction on this initiative.
How do we pay for it, Congresswoman? That seems to be the big question. And is it going to be a tax increase on the very wealthy, or as Speaker Pelosi is now suggesting, maybe a windfall profits tax on insurance companies? How do you pay for it?
Good question. I think that we haven't done a very good job explaining that to people. I mean, the pay-fors are still not in place. But I can tell you, the Senate version that just came out talked about putting a huge surtax on those insurance companies that charge too great a premium. And I think that that's a way of bending the cost curve down. There's been a lot of misunderstanding among seniors about how we extract savings from the Medicare program.
Yeah, should they be concerned? Seniors?
AARP has said emphatically that there's been so much misinformation about this. I mean, for one thing, you look at the Medicare Advantage program, which will not be discontinued. We will simply not pay that extra 14%, that unwarranted extra fee that Medicare Advantage extracts from the program and shifts costs from regular Medicare patients onto other patients. And that's going to save $156 billion a year. There are also going to be cost efficiencies realized from providing a greater care coordination, particularly for those seniors that have chronic illnesses, such as diabetes, that will save billions of dollars. The $110 billion agreement that the White House has come to with the pharmaceutical companies will be another way of filling that donut hole in Medicare Part D. These are the kinds of savings we're talking about.
So more to come in the weeks ahead. We shall see. We'll see whether we have a public option when it's all said and done.
Well, you know, we're going to fight for it in the House, make sure it's there at the bargaining table, and then see where we go from there.
All right. Congresswoman Gwen Moore, thanks so much for being with us today. We
Thanks
do appreciate
for having
it.
me, Mike.
Good to see you. Next on Up Front, health officials say the swine flu vaccine is safe.